I think we all know how important solving malnutrition is in the world. Uh, but I think what we're hoping from this panel is to really get some different perspectives of how are we doing that, but I think more importantly, how could we do that better? Because I think that is the crisis that we're facing right now. In fact, I was just reading a couple of days ago that there's some recent reports from Nobel laureats who say that solving chronic youth hunger, child hunger, would be one of the most important things that they would recommend that we do in our life. So I kind of want to start out. I mean, we know that nutrition and health is a very important priority in the current Feed the Future program. But I'd like Maura to kind of update us on how have things changed from the government's perspective and from USAID's perspective in terms of how are you going to be addressing hunger and nutrition in the future?
Thank you, and thank you for that talk from the Eleanor Crook Foundation. It sort of drove home why we're really all here today. USAID has and continues to be a global leader in nutrition and food security. By far, we're the largest bilateral funder or donor for nutrition and development in the humanitarian context. So over the years, there's been some amazing results. Some have been talked about just like through, the mixture that we discussed. What we're doing right now under the leadership of our current Administrator Green, is really elevating nutrition along with resilience. The previous panel, am I going on here? You guys okay? All right. The previous panel talked a lot about resilience, and for USAID, we're looking at resilience in terms of recurrent humanitarian crises. I mean, when I started, I did the Peace Corps in the mid-'80s, and then worked for CARE in East Africa and on Somalia in the early '90s when there was a horrific famine, and saw that firsthand. I think a lot has changed since then. We have made a lot of progress, as we talked about, but during the time when I started working in development, a lot of the humanitarian crises that we saw were caused by natural disasters, the majority of them. Some were caused by conflict. But now, today, we know that's kind of flipped on its head, where the majority of sort of the humanitarian crises that we see are caused by conflict, and not as much by humanitarian, or rather, by climate conditions and whatnot. So that presents to it, in and of itself, a huge challenge for us to be thinking about. At USAID, what we are doing is really putting that nutrition lens, elevating it. And first, to do that, we've looked internally at our own structures. And as an agency, we've been transforming and reorganizing ourselves. So those of you who work at USAID, you've probably heard us talk about our Bureau for Food Security is transitioning itself into what will be the Bureau for Resilience and Food Security. And within that structure, we will have a Center for Nutrition. Nutrition is addressed through different parts of the agency. Of course, our Bureau for Global Health is looking at nutrition from a health lens, and we have, Food for Peace and OPTA, which are looking at it through the humanitarian lens, and the Bureau of Food Security looks at it through an agricultural lens, as well as looking at food systems, market systems. And so with the formation of that center, we're also have stood up a Nutrition Leadership Council, which brings USAID agency leaders together across the health, humanitarian, and agricultural bureaus to focus and discuss budgets, and to look at technical recommendations, to look at policy recommendations, and programmatic oversight, so that when we are then also engaging with our external partners, we're taking a much more multi-sector approach in how we're looking at nutrition and food systems. Sure.
Thank you. I just realized that I neglected one of my most important duties as moderator, and that is to introduce the panel. I was so excited to get into solving malnutrition, something that I think about a lot, working on peanuts and working in Innovation Lab, that I didn't really do my duty. So I apologize to the panelists, because it is an excellent group of people to look at it from different perspectives. We've heard from Maura Berry, Senior Deputy Assistant Administrator for USAID's Bureau for Food Security. Next to her is Ellen McCullough, who is an Assistant Professor with the Agriculture and Applied Economics Department here in the College of Agriculture and Environmental Sciences at UGA. We have Tom Schaetzel.
It rhymes with pretzel.
Okay. Director of Nutrition and Care, based here in Atlanta, Georgia. We have next to him Lynn Bailey, who is Department Head for Foods and Nutrition in Family and Consumer Service here at Family and Consumer Sciences here at the University of Georgia. Samara Sterling is the Research Director for the Peanut Institute. And the Peanut Institute is the peanut industry's research arm looking at nutrition and health benefits from peanuts. She's based in Albany, Georgia. And finally, Alex Anderson is a professor in the Foods and Nutrition Family and Consumer Sciences here at the University of Georgia. So thank you all for agreeing to serve on this panel. I'd like to continue on. I mean, from comments that Maura made in terms of how the U.S. government, maybe ask Tom from CARES perspective. I mean, I know CARES has been working on nutrition and health since probably its inception. But do you see changes, or are you seeing new focus, new opportunities from your perspective?
As a matter of fact, I do. In particular, I have found Feed the Future to be basically a game changer. I mentioned I met the former Dean of Research in Agriculture here. I mentioned that my background is in agronomy before I saw the light and became a nutritionist. And for decades, we have struggled to have the agricultural sector actually give some importance to nutrition and to consider that improved nutritional outcomes should really be one of the goals of agriculture, not just increased production, not just increased incomes. And Feed the Future had some sort of, I don't know if it's fair to say, some birthing pains, but it's really changed the way everybody looks at agriculture globally because USAID is so influential. And people who in the past, people in agriculture and people in health and nutrition speak different languages. They have different incentives. And Feed the Future has really brought people together, focusing on this issue of how we're going to, is this really going to improve well-being, or is it just going to be about some sort of a livelihood improvement? And so I've found that sort of almost like a sea change over the last 10 years, thanks to Feed the Future.
And maybe I'll ask Lynn from UGA's perspective. I mean, you're in one of the units and departments that really deals with nutrition and health. Have you seen changes in the university's approach to dealing with these issues?
Well, I could speak from my perspective in terms of public health approaches. I've been at UGA in Foods and Nutrition for 9.5 years, and that was preceded by 3 decades at another land-grant institution. But my focus throughout this almost 40 years has been on the nutrient folate. Peanuts happen to be one of the best sources of folate. But nationally and internationally, I've been quite involved since the discovery that folate is a preventative agent for the most common and devastating birth defect, neural tube defects. So I've dedicated my focus over this 3 decades to prevention of these birth defects with folate, and was a member of the FDA folic acid committee here in the U.S. that led to fortification of staple food products. The dramatic reduction in neural tube defects in the U.S. and then in other countries has really motivated the interest for foundations like the Gates Foundation to try to come up with a strategy to reach the most impoverished And this is in low and middle income countries. So for the past 4 years, I've worked with Nutrition International with funding from the Gates Foundation. I have chaired an international committee to come up with strategies where we can reach these most malnourished, including the nutrient folic acid. And we focused our strategy on what we know works in developed countries, and that is folic acid fortification of staple products. But unfortunately, now we realize that the most impoverished women of reproductive age that need to consume the extra folate, those are out in the rural communities, and they don't have access to fortified products, and they don't have the financial resources to purchase them. So at this stage, I'm very excited to be here at the University of Georgia and to work with the University of Georgia researchers, with industries, nonprofit industries, major organizations like CARE, WHO, to try to strategize for sustainable techniques to reach those most in need of this nutrient to prevent a major birth defect.
And maybe I'll just ask Samara, you work at the Peanut Institute. I know you probably can't speak on behalf of the entire peanut industry, but I think from the Institute's perspective, are you seeing an increased attention in agriculture production here in the U.S. to the nutritional and health benefits of the crops as opposed to just providing food for the table?
Yes, so we have been seeing that, and I think it's an important piece because when we talk about conventional breeding methods, traditionally we have been breeding for taste or flavor or pest resistance. We talked a little bit about this earlier, but one of the areas that we're beginning to focus on is nutrition. How does the nutrient composition change as you do conventional breeding methods? And I think that the focus of breeding, agriculture, and nutrition, those two are so closely intertwined that we have to pay attention to it. And I'm very encouraged to see that as an industry we have been paying more attention.
I think that's a really important point, and it kind of ties with the panel before. And I know innovation labs are looking at that more in detail. I know even in the lab that I run, we look much more at the nutritional value and quality aspects of food, of the crop that we're producing, as opposed to just the quantity. And I think that is a tremendous shift that we're seeing. And I think that obviously reflects on even how U.S. universities need to be thinking of its plant breeding courses and plant breeding training that's given to students. The nutritional value is much more important. And I think now even we're seeing beyond nutrition, health value. I guess what I would like to have some of you, I don't know who even really to address this to, I'll let you decide who might be, but there are both a gender and a youth dimension to nutrition and health. And I was just wondering, how important do you see those two factors moving forward in terms of really addressing issues of malnutrition? Maybe I'll ask Ellen, because I know from a gender perspective you have some interest and some experience in working in that area.
Thanks, Dave. So what's interesting, I think, about the two panels we have today is we're really thinking about how to bridge agricultural resilience, as we were discussing in the first panel, and health and nutrition, which we're discussing now. I think it really comes down in many ways to food and decisions about food consumption. So, one of the powerful levers that we have is investing in agricultural R&D, making food more abundant, cheaper, safer, more nutritious. And ultimately, it really comes down to who in the household has the resources and the bargaining power to make the right decisions and the information and knowledge to make the right decisions about how to promote healthy diets, healthy consumption, and all of the other behaviors we know that are important for improved nutritional status in the household, whether it's sanitation and hygiene behaviors, and a whole host of interventions that, that many on this panel and in other places can speak to. So one of the things I'm excited to do in my research is to really model how we see households and in particular women responding to changing price signals, changing incomes in terms of what types of food they're demanding, so that we can really understand what's the role for making food more affordable, what's the role for making households more prosperous, and where do those types of interventions stop? What's the gap that we need to meet with nutrition-specific interventions and with consumer education and other types of interventions that might really help close the gap? So with funding from the Bill and Melinda Gates Foundation and the UK Department for International Development, I'm working on a research project that really aims to model food demand across 6 African countries, and to use that to really try and set agricultural R&D priorities, and also share information about these trajectories of decision making that are occurring within households, and what that means for priority setting, both in the health and nutrition space as well as in the agricultural development space.
And I'd like to, I was going to just
contribute
turn
to
over
that.
to Alex, because I know that you're working in a very similar area.
Yeah,
and
and when it comes to malnutrition, it's like we always focus more on availability of food, but in the developing world, it's not just availability. The culture plays a key role in who gets what. Male child versus female child, even the man of the household versus the woman. All this make a huge difference as to how the food is distributed and what part of the food this person gets based on maybe their gender and even the order of birth in the home. So it comes down to some level of education if you're going to eliminate malnutrition, education on this in the developing world, and not just making food available. The food may be available. You go to some household, for example, every summer I take students to Ghana as part of a study abroad program. And as we go to the children's hospital, and by the way, that is where severe malnutrition, kwashiorkor, was first identified and named, and we still have problems with kwashiorkor being brought to that hospital. So that means we are losing something. Almost 100 years ago, and we're still dealing with this problem because we are not tackling the root source. Yeah, this morning we've heard about the RUTF, which is good, but that is for emergency. We are again losing sight of the basic fundamental causes of malnutrition, which I think we should all come together to educate and also empower, as we've heard this morning, subsistence farmers in these developing countries, because most of them depend on just what they are growing. Others may have variety, but they are not complementing the foods well for full utilization of the nutrients in these foods to help with the growth and development of these children.
So you raise a really good point that I kind of like to follow up a little bit on. It almost relates to what Congressman Scott was mentioning this in the previous panel about the fact that in agriculture, we don't see immediate benefits.
Yeah.
We don't solve the disease very quickly. And there's this tremendous link. And I'm just wondering, is the nutrition and health angle going to allow us to kind of make that linkage much stronger? Because we're not just talking about producing more food, we're actually now able to go in through agriculture and solve nutritional and health urgencies. Do you see that as an opportunity now to make that stronger link that might actually encourage people to understand the role that farming really plays in the world?
I think so. Having education be ahead of the curve. For example, we heard about GMOs and the backlash in developing countries, including Ghana. By the way, I'm from Ghana. I was born and raised in Ghana. The backlash from there that GMOs are bad. But I actually had people call me to find out my take on GMOs, so that if there has been some education ahead, they would have a better understanding. The bill to introduce GMOs into the country stalled in Parliament. This is something that will also help boost food security in the country, make food available and accessible, but the population do not understand, thinking, oh, this is being introduced to sterilize our population, to do this, to do that. So education being ahead of the curve when it comes to nutrition and health. When we talk about this technology, like the phone, whenever Apple is introducing a new phone, before the phone comes on the market, they have some ad, some marketing ahead to sensitize people as to the benefit they stand to gain from these phones. Samsung does the same thing in nutrition and health. We are not. And as I mentioned, developing countries, culture, religion, or spirituality is very, very key if they're going to change the course of anything when it comes to their health.
I just want to ask Tom, I mean, what is CARE doing in the area of information and building the knowledge around the role that food plays in nutrition?
Thank you. We have a programming approach that we call Nutrition at the Center, in that we understand that improving nutrition is more than just about what people know, but we also need to have available nutritious foods. We need adequate health. We need women's empowerment. We need improvements in WASH. But then again, at the center of all that is about education and behavior change. I think when we talk about malnutrition, it's important to always to remember really who we're talking about. Kim was talking earlier about wasting. Wasting is by definition among children under 5 years of age. Stunting develops during the first 2 years of life, and after that is largely irreversible. So we're having available foods, having access to them, which means resources, knowledge about what to do. It still boils down to feeding, because children under 2 don't feed themselves. And so it has to be about whether the families understand what is an appropriate diet for these children, and then whether some gender constraints and the like can be overcome to help mothers and fathers, we hope, to feed their children appropriate diets for children at that age. Just tacking on to that, that there are many contexts in which families believe children can't eat things, like under 1 year old. They can't eat vegetables, it'll make them sick. They can't eat eggs, it'll make them sick. And these things are in the way of improving nutrition, and we try to overcome and at least redirect some of these beliefs about foods and what can be fed to children and how you can prepare them.
Samara, would you like to kind of describe a little bit about what the Institute is doing in terms of promoting nutritional and health benefits of peanuts in particular?
Yes, so for peanuts, of course, you've probably heard the term superfood, and so we do consider peanuts to be part of that because it is a nutrient-dense food, and that's one of the reasons why it's such an important part of the ready-to-use therapeutic foods, because peanuts provide so much protein as well. It's a good source of protein, excellent source of niacin and many other vitamins and minerals. And so at the Peanut Institute, we look at how that nutrition can help to improve overall health of populations here in the United States as well as abroad. We do most of our work here in the States, but what we found is that peanut consumption reduces your risk of dying prematurely from heart disease, cancer by about 23%. Niacin in peanuts can reduce your risk of Alzheimer's disease by 70%. And so we know that these same nutrients, when we talk about feeding the entire world and how children play into that malnutrition, that helps with proper growth and development so that it helps to prevent some of those diseases later on in life.
Maura, do you have any comments from?
I would just put in a plug. I mean, we've talked about the importance of research, the Peanut Innovation Lab. We also have a nutrition innovation lab. We just launched our first ever Feed the Future food safety lab. But on the nutrition lab, they've done a lot of research that they're going to be rolling out. And next week, I'll put in a plug. We have a e-consultation from the 12th to the 15th, beginning with a webinar on November 12th to complement this literature review and to define sort of the current research landscape, including all the gaps and opportunities. So we would love folks to participate, to validate the findings and prioritize the findings in the literature review, to understand the current research that was not captured in this literature review by the Nutrition Innovation Lab, and also to seek, of course, input from various practitioners. So I'll just put that plug in while I'm sitting here with this audience that's captivated with nutrition.
You raised the issue of food safety.
Yes.
It's kind of the alternate side of nutrition, the anti-nutrition. Are we doing enough in that area, do you think?
We need to
Are
do a
we
lot
doing the
more.
right
I think the
thing?
fact that we have been able to launch an innovation lab, I think that the whole conversation across the table, just underscores how much it's not about one thing or the other. It's a complicated food system of how do we ensure the, availability, affordability of of nutritious food. And it's a complicated system. It can have cultural aspects of it. There can be conflict, all sorts of different aspects that we have to come together and work smarter on coming up with solutions. Because if we can figure out to have all of these great technologies, I mean, when you look at how fast, I was at the AGRA meeting in Ghana last September, and their outgoing co-chair was talking about how fast technology moved on the cell phone in 10 years. Very rapid speed. Here we sit, still trying to figure. Yes, we've made huge progress. It was laid out for us this morning. We have made huge progress in addressing malnutrition, but we still have a huge challenge in front of us. So, technology, research, innovation, and collaboration, I think are all necessary components of doing a better job.
What are some of the technologies? We talked about technology a lot. We always think about that, I think, in terms of productivity technology, how that applies, but are there new technologies for solving or addressing or understanding nutrition and health aspects?
Okay, I would want to comment to that. At the moment, I'm part of a consortium with funding from the Gates Foundation that we're using technology for dietary assessment and handling in developing countries. So we're doing work in Ghana and in Kenya. So we have devices like glasses with inbuilt camera. We have earpiece with inbuilt camera. We have pendant. We have a baseball cap, all with cameras that households are supposed to wear throughout from when they wake up till they go to bed. Besides anything that requires privacy. So this is to help us identify their food sources, food handling practices, cooking, food distribution in the home, food consumption, and so forth. Things to do related to food. So we'll be able to document some of this cultural aspect when it comes to, the food is prepared, who serves the food, for example, who gets what, and how much, and particularly when you go to the rural areas where we see a lot of undernutrition. That's where we also find communal eating. So when the food is prepared, you have a bowl with the food in the center with family members gathered around, everybody eating from the same bowl. Are the children getting enough? And so forth. This technology is going to help us at least identify some of these so that appropriate intervention could be developed around that. And even some pilot that I did on this study during the winter, I saw something interesting that nobody even thought about in the home. Because we talk about vegetable oil. Here, you go to the supermarket or the grocery shop, you buy a bottle of vegetable oil, keep it in your home, and use it as and when you're cooking. Over there, not everybody can afford that bottle of vegetable oil. So we have retailers who rebag this oil into tiny bags. And I saw a household in the camera when they bought that small bag, instead of pouring the oil out of the plastic, they just dropped everything in that hot pan. Yeah, I see the faces here. So now you said, oh, they have the food, but look at the way they are preparing and what they are exposing themselves to. So this is an area that I believe this type of technology will help not just save, prevent malnutrition, but also ensure quality health.
Oh, just to add, I agree with Alex that we have really exciting opportunities to innovate with technology on the data collection side, because the truth is we just don't have very good data from developing countries about how food is divided within households, what kinds of practices are being used. So I'm also working on with CARE Ethiopia and World Vision Ethiopia with funding from USAID Livelihood for Resilience program in Ethiopia, working on trying to better understand women's time use and also dietary behaviors within the household. So we're trying to use cell phones to collect high frequency data to better understand some of these really important questions that are shaping the decisions that are taking place within households that are so crucial to improved nutrition and health outcomes.
It sounds like we're really got some exciting things going on to learn about what is currently happening. But it brought a thought to my mind that I remember a long time ago, at the beginning of the biofortification of food systems, a meeting that took place in Mexico, where we brought in the agricultural, from the plant side of nutrition, what do we know, how we could pump in more nutrients into the plants. We also had the human nutrition. And what shocked me after the 2 or 3 days that we were sitting there, neither side really knew much about nutrition. We didn't know a lot about how we could put more nutrients into plants. And human nutritionists didn't seem to really know whether they were going to make a difference or not. Do we know more now? Or do we need to do more to understand that even if we understand what people are doing now, can we make recommendations as to what they should be doing different? Do we understand that role that different foods play in human nutrition?
I don't think we know anymore today, because yeah, because the focus is let's produce, let's make it available. Is that translating to healthy nutrition? And along that line, we have another grant with a colleague in College of Engineering from the Feed the Future Livestock Innovative Lab that we're doing work in Burkina Faso. This work is about helping smallholder farmers raise guinea fowl, and guinea fowl is a staple in Burkina Faso and a number of the West African countries. And as we know, animal protein intake is very low in these areas. So the grant is to enable them produce more. If they produce, hopefully to empower them economically, but is it going to translate into the nutrition of the household? So we have a nutrition component with education that we are educating them around this. Yeah, you're making more. Yeah, you can sell, but also think about your household, particularly children. But most of the time, we don't factor that into a lot of projects we produce and sell everything. We can go to, and there are a number of examples, even from Ghana, that they went into what you call fish production in some rural areas. Yeah, they are producing this fish. You will think that as they produce, they eat is going to boost what their iron levels, but they were even worse off in terms of anemia because this pond breeds mosquitoes. Mosquitoes are feeding on the humans. They are not eating the fish; they are rather selling the fish to the urban areas and using the money for other things. So it's important that projects like this connect the different stakeholders so that we can look at these situations holistically, not just produce.
I'd like to add to that. I think we also have to, along with that point that Alex just made, we have to also think about the difference between eating a whole food rather than a fortified food. Mm-hmm. And now, of course, we understand as nutrition scientists that fortification is necessary in many areas. However, we still don't understand many aspects of the metabolism. So, for example, and this is sort of an offshoot example, but it relates. Early in the early 2000s, there was a study that was done on smokers to try to see if they could prevent lung cancer by giving them antioxidants. I think it was vitamin E or vitamin A, and the thought was that if you increase consumption of or supplementation of vitamin A, that this would act as an antioxidant to decrease lung cancer. Well, they found the exact opposite. And we still actually don't know why, but we do know that the metabolism tends to be a little bit different. And so understanding that when we talk about feeding the entire world, I think that's a crucial piece to think about.
So I would, one of the advantages of being a department head is that I learn from faculty like Alex Anderson. So I was visiting with Alex this week about the challenge that we have internationally with this project to try to get folate blood levels increased out in the rural areas in countries like in West Ghana, for example. And so if they are increase their peanut production, is that necessarily going to be consumed by women of reproductive age? So he gave me a little tutorial about how peanuts are integrated into the diet.
Yeah. So, for example, in Ghana, I teach a life cycle nutrition class, and I tell my students before I came to the US, I didn't know there was anything called peanut allergy. Yeah, so it was strange to me at first, simply because household eat peanut almost every day, either as snack or as soup or sauce. So this is an area that if we want to eliminate malnutrition, as I said, from the root cause and not just waiting till it occurs before we try to bring in therapeutic foods, that we encourage households to incorporate more and also blend with other sources to have a complete nutrition.
I want to follow up just kind of one last area that we talked a little bit about some of the new areas in terms of nutrition and understanding it. And one of the things that I think we've all heard about is that it's probably more important what's living inside you as opposed to what you actually consume in terms of what you gain from nutrition and health. And I'd like to ask Samara, because I know the Institute is looking at that, and I'm wondering, I mean, is that another kind of new wave of science that we really need to better understand in terms of addressing malnutrition?
It is. So you're talking about the gut microbiome and the fact that what we consume can change the composition and quantity of bacteria that lives within our gut. And what that does is it changes the metabolism, it can change the digestion. there's still more questions than answers for that as well, as it is with many areas of science. But we do know that we are seeing that certain foods increase the beneficial bacteria and are associated with reduced quantities of what we might consider the more harmful bacteria. And so with that, we get a clue into how certain whole foods act and their nutrients act synergistically to help to reduce disease risk and make us more overall healthy.
So do we have time for any questions from the audience? I'm trying to figure out which my order from. I have to go to my dean as okay. We've had some good ideas thrown out. Are there any questions from you? Yes.
Yeah, we strictly with social media, we don't do that much in terms of communicating directly with households and caregivers. But the advent of electronic devices in people's hands is something that we use quite a bit. Time-bound messages, like at 6 months, for example, a mother should introduce solid foods. We can program to have her get a message that says, okay, now it's time to start solid foods. And that one of the problems we always have in nutrition or any other development programs, how do you get contacts with the moms or the households? And this just makes things a whole lot easier when you can program those things. We also have used, I guess, for want of a better term, artificial intelligence. But if there's somebody here who knows about artificial intelligence, they're going to tell me I'm nuts. But we have developed some sort of smart programs that will help people diagnose, even to the point that people can diagnose crop diseases and understand how to respond to them off of their phone. The numbers that we get through research are that the percentage of people with smartphones is extremely high now, and that it's expected to get even higher because nobody's making dumb phones. And so this also gives us an opportunity to improve things like counseling at the individual level. If we have a system that we can have an interview there so that the system can identify problems in child feeding and provide a person with a small amount of training, provide them with good recommendations to give them out, but not strictly social media in that sense.
I mean, I would answer to say in terms of technology, for USAID, we are in the process of launching a new strategy on digital. We just had it out for public comment, particularly with the private sector, to see better improve how we integrate digital throughout everything we do in development. And there's so many different innovations with technology that touch upon food security and nutrition. I was out earlier in the year in Uganda and this is an example, met with a farmers cooperation where in using phone technology allows them to better work as a cooperative and have access to information on, available and safe fertilizer and other input tools as a farmer cooperation. Also having access to finance, using innovation to increase access to farmers to finance. Those are just some examples, but there's many examples out there. Weather prediction. There's a lot of innovations around weather prediction that's helping farmers to be able to grow more. Yeah. So, but others around the table might have other examples.
So at the Peanut Institute, we are heavily involved in social media. One of the things that we are passionate about is translating complex science in a way that general consumers can understand. And so part of my work is to do that. And so when scientific information comes out, we put it in a way that people can relate to. Not just saying, oh, it will reduce your mortality risk by 23%. Do people actually understand that? We put it in simple terms and also show them how they can incorporate healthy foods like peanuts into their everyday diets. We are able to see every month from our media report where our followers are in the world. And we do actually have quite a large following from Africa as well. And so what we do is we tailor a lot of the recipes. So we have a lot of the African peanut stews. We have a lot of the cultural recipes that are there that will help people and encourage them to eat healthier diets as well.
Great. I just, one comment on the social media, because I think it's very important, and I think I totally agree with Samara said. It's not so much about the vehicle, it's the message. And I think that's where we're beginning to see a lot of how do we communicate what is very technical and scientific, whether it's to a consumer or to a farmer or to an extension agent, so that they can understand it, you know, in their terms. The other thing I would comment, and kind of taking it back to the previous panel and talking about reading, one of the interesting uses of social media that we're seeing in our own program is that we now have a WhatsApp network of all the plant breeders and peanuts in Africa. And they communicate. If I want to communicate to all of them, I just do a WhatsApp real quick. And I get them all to respond to me. And they're solving their own problems through that social network. And I think we're seeing that even more, that as we build that research capacity in many of our countries, that social media is really important. It could be a big game changer as well. Definitely opens up great opportunities. So I think we're out of time, unfortunately, but I would just like to have everyone thank our panel for their excellent comments. And thank you for your attention, and I'll turn it over